Okay, so these are your controlled articular hip circles, or CARs, they're commonly known as. And the idea is that you are really finding your honest range of motion in one particular area. So in this case, it's for your hips, without any other body parts getting involved or trying to cheat or help out to compensate for that movement. So the idea is that you want to create some tension in the body, because it's called a radiation. So create some tension so the body's not relaxed. And then from here, we're going to be picking up the leg. So use a wall if you're a little bit off on your balance. Picking up the leg, but you're trying to turn the thigh bone. So if you had an X on the front of your thigh bone, you're trying to rotate the thigh bone outwards. Now from this angle, flex the foot and lift the leg up as high as you can possibly lift up. So the knee is traveling to the left, the sole of the foot is almost trying to get to the right. You're almost trying to get this shin as parallel as possible here. So from the side, it looks like this. Getting up as high as you possibly can without rounding, pushing the hips forwards or bending the knee. Once you get to this end point, you're then going to abduct, so you're taking away the leg from the midline out to the sides. You're trying to push the knee as far back as you possibly can without rotating the body to the side, so the pelvis is still facing forwards. Once you get to this angle, you then find internal rotation in the hip. So the thigh that was traveling and looking backwards, the X, we're now going to try and drive it forwards. This creates an internal rotation in the hip. And then from this position, we then extend the leg back behind us. This can get a little bit crampy without arching the back. So again, keep the back and the rest of the body really, really still. Then we bring the leg all the way down and we do it all over again. So to repeat, we come up, out, rotate. This part can be really sticky on a lot of people. You might have to drop the knee down just a little, because otherwise what happens is the pelvis can hit up, extend back, and down. We go again, up, out, rotate, extend, and take it down. And then you'll repeat it 3 to 5 times on one side and 3 to 5 times on the other.